I want to talk today about testing, and we're going to continue to report to you what we're doing to bring more testing to the state of Ohio. At the front line of our healthcare providers are our pharmacies. Fran and I grew up in Yellow Springs. Our pharmacist was an integral part of the community. Bud and Vera Johnson, the time we were growing up, and having a local pharmacist in your community and a pharmacy is just vitally important. It's one of the great things that you can have, and the pharmacists, whether they work in a chain or own their own store, they're a vital part of our healthcare system in the state of Ohio. They truly are trusted community members, healthcare providers. They interact in our lives every single day. That's why I asked the Ohio Board of Pharmacy to clarify and to make it very clear about what pharmacists' roles can be in regard to testing for COVID-19. Yesterday, the Board of Pharmacy released updated guidance clarifying HHS rules that allow pharmacists to order and administer tests for COVID-19. Access to these tests is vitally important, and I'm working aggressively with the Ohio Pharmacists Association. I talked to them, frankly, just this morning, and our pharmacies to make sure that these tests are available. Pharmacies are an important part of our plan to fight COVID-19, especially as we look towards the future beyond testing and towards a vaccine. To help Ohioans find testing locations, we're adding a map on our website that shows COVID-19 testing centers. This map includes community health centers as well as retail sites such as CVS, Walmart, Rite Aid. And as we get more of these locations, more of the pharmacies decide to start doing this, we will obviously add those to that map as well. The webpage will also have links to community health centers and each retailer's website, where you'll be able to find information about how to get a test referral or schedule an appointment. This map will be on the coronavirus website at coronavirus.ohio.gov. I also talked this morning again to Maureen in regard to making sure that we are covered on Medicaid for people who are getting these tests at these pharmacies. So that is a work in progress, but we're going to do everything we can to make sure the pharmacies can do this and can do it as quickly as possible. Let me go into another area in regard to testing. We are today expanding the criteria, the allowable criteria for testing facilities and people doing testing that are directly related to the Ohio Department of Health. We've had 3 categories, and we're adding a 4th. Currently, Category 1 is hospitalized patients with symptoms and healthcare workers with symptoms. This includes nursing home employees, behavioral health workers. 2, again, this is currently, people at high risk of complications from COVID-19, including residents of long-term care facilities and congregate care facilities, patients 65 years of age or older with symptoms, patients with underlying conditions with symptoms, racial ethnic minorities with underlying conditions with symptoms. That was Category 2 and remains Category 2. Category 3, individuals receiving essential surgeries or procedures not requiring an inpatient hospital admission. Priority 4, that what we are adding is individuals in the community who have symptoms. So individuals who have symptoms. And the exact language is individuals in the community to decrease community spread, including individuals with symptoms who do not meet any of the above categories. So this is an expansion. We are talking with hospitals to expand the hospital testing and the surgeries allowed. We're not making that announcement today. That's not quite done yet, but we will be making that announcement.